While so many businesses and organizations come to terms with the immediate impacts of the pandemic, it is without a doubt a defining moment for the world of healthcare.
From the acceleration of telemedicine to the inflection of racial disparities, we're showing you how our state's healthcare leaders are looking to the future with lessons that will change the industry for good, taking a time of such pain and turning it into purpose.
Inside an unassuming building in Shoreline.
We have been at this longer than anybody else in the U.S.
Modern medicine is making bold strides.
I knew from the very beginning this was going to be a marathon, so I paced myself.
State epidemiologist Dr. Scott Lindquist led the team that diagnosed the very first case of COVID-19 in the U.S.
We got what we paid for in public health. By not funding it, we had data systems that were pretty antique. We had not enough staff to respond and do all the things we needed to in this pandemic.
Of all the lessons learned, Lindquist says understanding and investing in the mission of public health is at the top of the list.
I hope one thing we have learned in this pandemic is you have to invest in the offensive line, just like you do in football. You got to do that in life with public health.
Being behind the ball is not how you win a game. And for State Secretary of Health, Dr. Umair Shah,
So I think it's been tough.
being behind the curve is not something anyone should forget anytime soon.
It has been an intense year.
Deputy Secretary Lacey Fehrenbach remembers all too well.
There wasn't a playbook for how you come out of that. There have been many, many sleepless nights. There have been nights you fall asleep and then you wake up panicked. Has been unquestionably the hardest thing I've ever done, and also, in my view, the most important thing I've ever done. I can't really imagine a greater privilege than to try to help everyone navigate through this. And that's what gets me up every day.
As organizations across the nation struggle with the immediate impacts of the pandemic, healthcare leaders are planning for the future, knowing that COVID-19 has reshaped and restructured the industry.
The days of getting cultures and having them on plates and freezing them after we're done and pulling out these plates 10 years later to look at them, it's all gone. What we will do is simply genotype the specimen, and we'll keep that in a data bank.
We've learned so much of how we can advance medicine, advance science, advance research, advance vaccines, advance all sorts of actions that we never thought we could do that quickly.
COVID-19 very quickly put before us pretty large inequities. You see big differences in infection rates between communities of color and white populations, and in particular, Pacific Islander communities, Hispanic, Latinx communities, and Black communities.
From testing to contact tracing.
Things that would take weeks or months to do, we're taking hours.
The development and distribution of vaccines.
It showed us you can take healthcare almost anywhere. People were vaccinated in parking garages. They were vaccinated in fair buildings. They were vaccinated at their work sites, at churches, at grocery stores.
What is the role for masking as we go forward? Even if COVID's gone, should we be better maskers, respiratory etiquette, and social distancers with any respiratory virus going forward? I think that has changed us.
Taking a pandemic that has caused so much pain.
Together we can do so much more.
Ready to open our restaurant.
And turning it to purpose.
I have faith in science. I believe in science, and it has steered us well in this.
Let's give it Washington. We're ready and we are open. Go Washington. All right.
So one thing we saw was that the flu was almost non-existent, right? Because we're all wearing masks. Are they looking at that kind of thing going forward, and whether, you know, there's a cure for that someday or a vaccine for that someday? That, you know, we have the flu vaccine, but it still comes back over and over again.
That's true, but there's also other things in place now, like masks. They don't think they're necessarily just going to go away like that. So maybe that will keep the flu season from getting out of hand the way we've seen it in years past. But just hearing from those healthcare leaders, I mean, we would see them get up weekly and give us those updates, and they were also impacted too by COVID-19. We all were. So it's good to hear that at least coming out of this, we've got something to look forward to in the future, something that we can plan off of.
Well, we're grateful to them. I can hear the emotion in their voice, how important this was, and also how draining it had to be emotionally. So thank you.